Hello, everyone. Welcome to Lump Basics. We are now on our 36th week. Let's start with horary points. Let's welcome Certified Associate Acupuncturist from Legazpi, Sir Dino Pinheiro. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with Lump Basics, the horary points. The diagram below shows the horary points in the central circle of the organ clock. So we have here the heart 8 as we observe the diagram, which is the heart point. Meron ding small intestine 5, which is the fire point. UB66, the water point. Kidney 10, the water point. GB41, the wood point, and liver 1, the wood point. Lung 8, the metal point. LI1, metal point. The PC8, the fire point. Triple warmer 6, fire point. Stomach 36, earth point. Spleen 3, earth point. So we have here the questions for training. A male patient aged 58 presents with recurrent headaches in the vertex, waking up around 1 a.m. every time he gets them. He never gets this headache at other times of the day. This lasts through the day and gradually disappears in the afternoon. He had noticed that if he drinks black coffee quite late at night before going to bed, these headaches may be prevented. How can you explain this, and what would be your treatment? Number 2 question, is there any truth in saying you must eat breakfast like a king, share your lunch with a friend, and give your dinner to your enemy, and why? Number 3, a young man comes to you with problem of urgent watery stool following abdominal colic starting around 5 a.m. in the morning. He passes 3 to 5 stools before he is ready to leave the house. The symptoms are worse if he has to go to work in the morning and much better during holidays. How can you help him? Thank you po for your attention.
So we shall answer. For those who wish to answer, just write your answer in the chat box, and we will talk about it later at the end of the presentations. Thank you very much, Sir Dino. Now let's go to points that influence the quantity of energy. The quantity of energy flow. All the other energy balancing points are involved in sending energy from one organ to the other, or from one meridian to the other. Try to imagine these pathways of energy flowing at many levels of depth in the body. Depending on the depth of energy flow, we call them the deep energy circulation and superficial energy circulation. Superficial energy circulation is between the exterior meridians, or the meridians that flow between the skin and the muscle. Deep energy circulation is between the deeper meridians that flow from organ to organ in the interior of the body. So the superficial energy circulation flows mostly from exterior yin meridians to exterior yang meridians. And since there is a difference of polarity between the medial and ventral sides of the body, where the yin meridians run, and the lateral and dorsal sides of the body where the yang meridians flow, there is also a change in the polarity of energy when it flows from a yang to a yin meridian and vice versa. Since the exterior meridians have points that can be directly stimulated, the superficial energy flow can be manipulated directly. The deep energy circulation flows in the interior of the body. Energy may flow from a yin organ to another yin organ or to a yang organ, but the energy that flows out of this yin organ would always be of a yin nature, and wherever it flows to, it would remain as yin and bring about an increase in the yin of the other organ. As the deep meridians have no points and cannot be needled, we can only gain access to them through the exterior meridians and try to influence the deep energy flow indirectly. Couple organs, the interior relationship, deep energy circulation. The coupled organs, lung, large intestine, heart, small intestine, and so on, are said to have an interior-exterior relationship. This means that they are related in the interior, the deep energy circulation, and in the exterior, superficial energy circulation. Therefore, they are very useful in energy balancing treatments. Okay, so starting next meeting, we are going to take a look at the deep energy flow between the lung and large intestine. Thank you very much for your attention. Let's now listen once again to Sir Dino. He will continue discussing the needling techniques. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the needling techniques. Next topic is to retain cup. Sa shoulder pain, treat with local points such as LI15, triple Wermer 14, GB21, and other ASHI points and distal points. Add influential points for muscle and tendon, GB34, and influential point for bone, UB11. Leave all needles for 20 minutes. Remove the local needles only after 15 minutes and place 2 to 3 cups on the pain area. These cups and the rest of the needles may be removed after another 10 minutes. This is an excellent in bursitis and pressure pains when the patient cannot lie on the painful shoulder. Sa backache naman, after local needling, 2 to 4 cups may be placed for 10 minutes on the painful area. This is an improvement in the range of movements immediately after treatment. And you will see that the patients can put on their socks and shoes much more easily than before the treatment. Cupping is especially suitable in pains which occur when starting to move after rest, with stiffness and reduced mobility, and which take a long time, 2 to 3 hours after getting up from sleep to improve. Next, osteoarthritis of the hip joint. This is treated locally with either hot needles or electrical stimulation of needles, depending on whether it is a cold or hot pain. At the end of needling, 4 large cuffs may be placed around the hip joint and removed after 10 minutes. This increases the mobility of the joint. Cupping in edema and damp stagnation in organs. Cupping works well on an area with cold edema. In the treatment of osteoarthritis of knee, there is often some edema around the knee. Cupping may be used in these areas and is very effective. In damp conditions of internal organs, especially in cases where the elimination or circulation of fluid is poor, cupping on the back shoe points of the organ will be helpful. Examples: cough with excessive phlegm, chronic bronchitis or asthma, cup UB13, back shoe points of the lung, peripheral edema, cupping of UB20, back shoe point of the spleen, oliguria with water retention in chronic pyelonephritis, UB23, Bakshu point of kidney, urine retention and bladder instability, CAP UB28, Bakshu of urinary bladder. Cupping is also very effective in the management of ascites or lymphedema in any area of the body. 2 points should be used simultaneously for this, REN 5 and REN 9. These points are needed for 10 minutes. And when these are removed, the cups can be applied for another 10 minutes. Since cupping is usually performed using fire to create a vacuum, it often leaves a bruise that takes a few days to disappear. If the patient wishes to avoid having bruises, then intermittent cupping should be applied. This is a method where the cup is applied and removed immediately, making a popping sound several times till the affected area is quite red and warm. Thank you po for listening.
Thank you very much, Sir Dino. Now let's continue with the earth element. Associated climate is dampness. Exterior dampness affects a weak part of the body, if there is one, and if there is no weak part of the body, it affects the organs of the earth element. The spleen and stomach are the organs that create interior dampness. Dampness relates to the thick fluids of the body, which include blood, lymphatic fluid, and fat. When these fluids increase in quantity, or if they stagnate without circulating, there would be interior dampness in the body. If there is excessive dampness, this is possible with or without poor circulatory function. There could be symptoms of edema. This is mainly in the center of the body, the spleen and stomach, and in the periphery, the hands, feet, and face, because spleen circulates fluid in the periphery. Other symptoms are heaviness in the arms, legs, or head, fullness in the middle, semi-solid stools, band-like headache with pressure from outside to inside like a band or a helmet, and nausea. When the circulation is affected and the dampness is stagnating, it chooses an area or a meridian already suffering from Qi deficiency and stagnates there. Therefore, we see edema in a joint or on a particular meridian, a bursa or a tumor in an organ. Fluid stagnation in a meridian. So there will be pressure pain on the shoulder, hip, or sciatic nerve. The patient has pain to lie on the joint or to sit on the area of sciatic pain because the fluid causes more pressure pain. Treat with local cupping and luo point of yang organ. For instance, if there was pain on tripal warmer area on the shoulder on lying, then give 2 to 3 local cups for 5 to 10 minutes and point tripal warmer 5 luo to sedate the yin and tonify yang. In other words, remove stagnation of fluid locally. Fluid stagnation in small joints of hands and feet, a common symptom of arthritis. It would not be possible to treat each joint individually. This causes typical starting pain in the mornings and takes gradually up to midday to feel better and supple. Until then, movements are limited and stiff. Treat with spleen 9 and stomach 40. Spleen 9 is a diuretic point and stomach 40 is a luo point. Together, these points would both eliminate and circulate fluid. If the patient could keep off fatty milk products, refined sweets, and carbohydrates, avoiding raw and cold food and drinks, the pains will improve within a few weeks without any local needles. Bursa on a meridian. Baker's cyst, trochanter bursitis, cold or hot bursa are firstly a symptom of damp stagnation on the meridian it manifests. This can be the reason for recurrent inflammation. Treat with local cupping and luo corresponding point on yang meridian. For instance, trochanter bursa is damp stagnation on the gallbladder meridian. Therefore, GB37 luo connecting point is used along with 3 to 4 local cups retained for 5 to 10 minutes. Tumor formation in internal organs. Any tumor formation is initially from local stagnation of dampness. It is then only a soft tumor. But if the thin fluids in the body dry out at any time, this could become a hard tumor. A hard tumor has a more potential to change into a heat or cancerous growth. This will grow at a much faster rate and penetrate into other organs and tissues, consuming all as it spreads. Treat in the dump phase with local cupping on the back shoe point of the organ and luo connecting point of the young organ. Avoid dump-producing foods. Advise patient to exercise regularly and in moderation. Improve the elimination processes. Stools, urine, and sweating. Before this heat phase, there is a damp phase. This is a slowing down period for qi, where every cell gradually loses its protecting energy shield called the wei qi. When the function of eliminating harmful energy comes slowly to a standstill and the cells hold all their waste and the fluid circulation slows down. Dampness is a symptom to be taken seriously. If there is interior dampness, it is always generated by the spleen, no matter where the symptoms manifest. Therefore, it becomes important to treat the manifesting area or organ with local cupping and luo connecting of the young organ, and to balance the spleen and stomach with spleen 9, stomach 40, and changing the diet. Many diseases could be prevented by treating symptoms of dampness as completely as possible when the problems are mild and in the early phase. Thank you very much for your attention. Let us now listen to Sardino for general principles of treatment and disease prevention. General principles of acupuncture treatment.
Okay, good afternoon again. We continue with the general principles of acupuncture treatment. Regulating yin and yang, strengthening the body, resisting and eliminating the pathogenic factors, distinguishing the primary from the secondary. Regulation of yin and yang. Occurrence of disease is due to imbalance of yin and yang. Regulation of yin and yang. Fundamental principles in clinical treatment. How to regulate yin and yang is most important in acupuncture treatment. Excess yang makes yin suffer. Excess yin naman makes yang suffer. Excess heat, which is yang, is likely to injure yin essence. Excess cold, which is yin, is likely to damage yang qi. So treatment is to reduce excess heat or expel cold through methods of removing excess and reducing preponderance. Check whether a corresponding yin or yang deficiency exists. If one is deficient, consideration given to both yang reduction plus yin reinforcement, dispelling cold plus warming yang simultaneously. Yin deficiency fails to control yang. Deficiency heat syndrome plus yang hyperactivity due to yin deficiency. Yang deficiency fails to control yin. Deficiency cold syndrome plus yin excess due to yang deficiency. Treat yin for yang problems. Treat yang for yang problems. Yang hyperactivity strengthen yin to control yang. Cold yin reinforce yang to control yin. If both deficient, yin and yang should be reinforced. So we have here at our diagram, first po, balance po siya. Sa yang deficiency, which is cold deficiency, mababa po yung yang. Sa yang excess naman, heat excess, yung yang is mas marami. Sa yin deficiency, heat deficiency, yung yin is mababa. And sa yin excess, cold excess, mas mataas po yung yin than normal. Sa regulation of yin and yang, diseases marked by yin or yang deficiency achieve yang from yin, achieve yin from yang because they are interdependent. Example from mu points and bakshu points used respective to regulate and replenish yin qi and yang qi of zang-fu organs. Yin and yang are general principles for differentiation of syndromes. Relieve deficiency by tonifying method, reduce excess, dispel cold by warming method, nutrient and defensive qi regulation, qi and blood promotion. Thank you for your attention.
Thank you very much, Sir Dino. Okay, up next is continuation of where we left off last time, tonification on the mother-son cycle. Clinical example, we have a female 18 years old. A young girl complained of problems with urination for 4 years. She was unable to pass urine even when she had a full bladder. She had been catheterized on several occasions with this problem and now had an abdominal catheter. Though she was quite introverted and spoke very little, we also found out that she had bowel movements only once in 5 to 6 days with laxatives. She had had menstrual bleeding only twice in her life after age 14. It seemed that the patient's large intestine, bladder, and reproductive organs, which are related to kidney and urinary bladder, had an elimination problem. Elimination is a function, the yang aspect. If the yang in the large intestine is improved, then the bladder function could improve as well. Okay, so as you can see on the tower diagram and the schematic cycle of the mother tonifying the son. Treatment, Li4, stomach 25, and triple warmer 6, which are symptomatic points against constipation. We use Li4, the great eliminator, bladder 28, needle and cupping, because this is the bakshu of urinary bladder, paravertebral tapping of lumbar 2 to sacrum 4 with plum blossom needle. This improves the function of internal organs in the area. So it's from lumbar 2 to sacrum 4. REN 3, sedation, the front viewpoint of the urinary bladder. As the mother organ, the large intestine improves its function. The son organ, the urinary bladder, receives this qi and its function improves as well. So it's from the Li to urinary bladder. All the above cases are examples of tonification of the mother as a sufficient measure in cases in which mother and son are both deficient. So sedation on the mother cycle. So for the yin organs, we have lung 5, heart 7, liver 2, kidney 1 or 5, spleen 5, and pericardium 7. Sedation points on the yang organs, Li2, Si8, GB 38, UB 65, stomach 45, triple warmer 10. If an organ has excess of yin or yang, it has the possibility to send the excess away to its son. If the excess state persists, there can be 2 reasons for this. First, there may be a block in the flow between the organ and its son. Second, the son organ may also have an excess state. Therefore, it is not possible for energy to flow from where it is in excess to where there is again an excess. Okay, let's consider a case of lung edema or fullness and excessive mucus in the lung. This would be excess of lung yin. It also means that the yin does not flow down to the kidney, which is the son organ. We could send this yin away from the lung to the kidney by sedating using sedation needle technique, lung 5, the water point of the lung. This will unblock the energy flow between the 2 organs. Sedating lung 5 in the yin organ will sedate both yin and yang of the lung. But since lung and its son kidney are both yin, It will sedate more of the yin and only a little of the yang, like 90:10, which is fine. But if the patient already has water retention and general edema, then the lung edema or excessive mucus is because the lung cannot descend water to the full kidneys. It therefore becomes necessary to improve the kidney function by using bladder 23, the back shoe of the kidney, and bladder 58, luo connecting point, to increase urination. Or one could simply sedate kidney 5. The sedation of kidney yin or the increased urination would instantly and automatically reduce the lung edema or the excessive mucus in the lung. Kidney 1 is generally not used with sedation technique, as some trials have shown that after kidney 1 sedation, sometimes the kidney function does not return to normal for a while. In growing children, it is forbidden to sedate kidney or urinary bladder, as this energy is needed for bone growth. In adults, when kidney yin needs to be sedated, one could sedate kidney 5, the she cleft point. Thank you very much for your attention. We now proceed to meridian theory by Sir Dino Pinheiro.
Okay, we continue with lung basics, the pericardium meridian of hand extreme yin. The pericardium meridian begins near the kidney exit point on the lateral side of the nipple, as illustrated. It then flows up towards the shoulder and curves downward ventrally to flow along the center of the arm, ending on the middle finger. The interior meridian originated from the chest, from the pericardium, and flowed through the upper, middle, and lower warmer of the body. Another branch starts at point pericardium 8 at the palm and flows to the ring finger to join with the triple warmer meridian at triple warmer 1. Pericardium 1 location in the fourth intercostal space, 1 tune lateral to the nipple. Point explanation used only as an entry point of the meridian. If there is a pain following breast surgery, this point or when this area has been removed, any point along the remaining pericardium meridian should be needled together with the kidney meridian point at or before kidney 22 exit point. Next, pericardium 4, location 5 tune proximal to the anterior space of the wrist joint, most distal wrist crest, between the tendon of the palmaris longus and the flexor carpi radialis muscles. Point explanation, the C-cleft point of the meridian. It is a safe and useful point to be sedated in acute problems of the heart and pericardium. Sabi dito, use it wherever heart sedation is warranted. Next point is pericardium 6, which is located 2 tune proximal to the anterior wrist joint space, most distal wrist crest, between the tendons of the palmaris longus and flexor carpi radialis muscle. This is used as an important point that every acupuncturist should use, as a simple point that patient may use for acupressure massage. It is an area distal point for the thorax and upper abdomen and a symptomatic point for many symptoms such as nausea, vomiting, cough, asthma, chest pain, stomach pain, hiccups, tachycardia, and arrhythmia. PC7, which is located on the anterior aspect of the wrist joint space, most distal wrist crest, between the tendons of the palmaris longus and flexor carpi radialis muscle. This is used in the sedation point of the meridian. It sedates more of the yin than the yang. It is often used as a one-point therapy point for heel pain in the calcaneus part or plantaris fasciitis. Next point is PC8, which is located in the center of the palm between the second and third metacarpal bones, slightly closer to the third metacarpal bone. This is another of my, sabi niya, favorite points. This is the fire point and the house element point of pericardium. It can tonify or sedate pericardium yin, though it is mostly used in tonification. This is done simply by placing the needle rather superficially on the point. It is excellent in treating dry, cracked, or peeling palms and other yin deficiency symptoms such as warm palms. This is also the exit point of the pericardium meridian, where it flows into triple warmer 1. Next point is PC9, which is located on the most distal point at the tip of the middle finger. This is used in the tonification. This is a tonification point. Bleeding of this point is beneficial in letting out heat. It is used in fever in children, high blood pressure in adults. It is very safe in treatment of high blood pressure in pregnancy. Thank you for your attention.
Thank you very much, Sir Dino. Okay, so now we come to the last topic for today. Still on chest painful obstruction syndrome. Liver fire harassing the heart in the chest. There is chest pain, palpitations, irritability, propensity to outbursts of anger, thirst, feeling of heat, bloodshot eyes, insomnia. Tongue red with redder sides and tip, dry yellow coating. Pulse, wiry, rapid. Treatment principle: drain liver and heart fire, free the chest, calm the mind, settle the ethereal soul. Points: liver 2, stomach 40, pericardium 6, LI 4, lung 7, all with even method. Liver 2 drains liver fire. Stomach 40 opens the chest. Pericardium 6 helps to regulate the liver, calms the mind, settles the ethereal soul, and opens the chest. LI 4 and lung 7 regulate the ascending descending of qi and make the qi descend. Now let's proceed to identification of patterns in treatment empty, or the deficient patterns. Spleen and heart-yang deficiency. Clinical manifestations: a feeling of oppression and dull pain in the chest. Dull pain because it's empty. Breathlessness, palpitations, sweating, feeling cold, cold limbs, bright pale complexion, cyanosis of lips and nails, tiredness, poor appetite, insomnia. Tongue pale or bluish purple. Pulse deep, weak. This is due to long-term deficiency of spleen-yang deficiency, leading to heart-yang deficiency. This manifests with a cold feeling, cold limbs, especially the hands, palpitations, insomnia, sweating, bright pale complexion, and cyanosis of lips and nails. Deficient heart-yang fails to invigorate blood in the chest. Blood stasis causes pain and a feeling of oppression and a purple tongue. Long-term deficiency of yang of spleen and heart nearly always has its root in kidney yang deficiency. This is especially so in old people. In this case, in addition to the above manifestations, there would also be sore back and knees, dizziness, and frequent pale urination. Treatment principle: tonify the qi, warm yang, invigorate blood, invigorate the connecting vessels. Points: bladder 15, Ren 14, heart 5, bladder 20, Ren 12, Ren 6, stomach 36, spleen 6, bladder 23, 2, 4, pericardium 6, kidney 25, bladder 13. Reinforcing method on all points except pericardium 6 and kidney 25, which should be needled with even method. Moxa is applicable. Bladder 15, Ren 14, and heart 5, we moxa. Tonify heart yang. Bladder 20, Ren 12, Ren 6, stomach 36, and spleen 6, tonify spleen yang with moxa. Bladder 23 and do 4 with moxa, warm the kidney yang. Pericardium 6 opens the chest, stops the pain, and relieves a sensation of oppression. Kidney 25 is a local point to move qi and blood in the chest when there is an underlying kidney deficiency. Bladder 13 with moxa tonifies lang yang and strengthens the gathering qi or zong qi, which provides qi to the heart to invigorate the blood. Thank you so much for joining us today, and we hope to see you again in our next presentation. Good afternoon, everyone.